Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-Hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Adam, we've just started. Hello, Adam. How are you doing?
Hello, Haidar. I'm good, thank you. How are you?
Well, I'm very well. You talk about professionalism a lot, and something that is always mentioned when it comes to doctors and doctors' work and lifestyle. I mean, is this something that we can teach? Professionalism?
Well, I mean, towing the party line, I'd have to say yes, simply because I was involved in being a seminar facilitator at Cambridge Med School, teaching on the Professionalism, Ethics and Law course, and it's one of those things, isn't it? If you sort of get people early enough, so when they're undergrads and they sort of think they're invincible and untouchable because they have that kind of arrogance of youth, that they are quite shocked when they're told that actually you can be disciplined by your medical school akin to the way the GMC disciplines, fully grown doctors for, gross misdemeanors and so on, It then, as people get older and more established in their career, and the GMC they have graphs of different spikes of activity along your career in terms of getting action taken against them. And, you look at those sort of quite late on in their career who maybe they're kind of peri-retirement, they're kind of given up, they're fed up of the establishment and the system and the changes being imposed on them. And they just get a bit renegade, some of them, and it's like, well, can you teach professionalism to that cohort of doctor, are they just so lacking in insight that you can't? Do you know what I mean? So you need to sort of have the ability to appreciate it, I think, to be able to teach it, but you need to put it out there as a concept early on, otherwise people they almost don't know it exists, so yeah.
I find the definition quite difficult to understand and wrap my head around. I mean, is it something that the hierarchy defines what professionalism is, or is it sort of an innate thing that you have and it just needs to be shown to you what professionalism according to the system is?
So how do we learn our professionalism? How do I know that what I'm doing is ethical and morally sound, and am I practicing with integrity? Which as you'll see, little memes and so on social media. Integrity is what you do when no one's looking at you. That's how you act when no one's looking at you, and you'd be the same as me. I'm sure when we were at medical school, we were looking to our seniors. When we were clinical students, we were looking to our consultants, regs, SHOs, housemen even, for a steer on how it's appropriate to behave. So there is that kind of that learned thing through going through the profession, the medical profession, and I'm sure it's the same in other professions as well. Obviously, I have a barrister qualification as well, and there's similarly rigorous regulations with the Bar Standards Board and the Solicitors Regulatory Authority as there is with the GMC, so and there'd be the same for accountants and whatever. So professions all rely on a bedrock of professionalism, I think, to be even deemed professions. But yeah, are these organisations and the powers that be and the people in the ivory towers and whatever dictating professionalism to us because it's a societal expectation? Are they merely the sort of conduit for what is expected by the person on the street of a doctor, of a lawyer. It's a complex question with a lot of levels to it, I think.
Yeah, I mean, there are sort of political issues, social issues. That's on the conscious side, and then you've got the subconscious side, which is sort of international, and then sort of humanistic and spiritual. So all of these sort of take into account.
Yeah.
But recently there has been this conflict between the hierarchical professional regulators and certain actions which are deemed unprofessional, and then sort of a backlash recently with the Bawa-Garba case.
Yeah.
I mean, that sort of caused whether we're just tuning into the people who are causing the issues. Are we sort of concentrating too much on that, or do you think there is an underlying issue going on here where there isn't enough open debate about professionalism and regulation of this professionalism?
So I need to be careful what I say here, really, because
sure.
I'm not entirely convinced, and this is just my opinion, that there isn't an institutional basis for what happened with Dr. Bawa-Garba within the GMC itself.
Yeah.
And I could go into that, but this probably isn't the forum for it. But people who are in the upper echelons of the GMC coming out, speaking to GPs, and I've been in the audience of these things as recently as last year, where they're still trying to make excuses for it and still trying to make out that actually it was her fault, and that does not sit easy with me.
Yeah. I understand, and that's why there has been this sort of unrest in the psyche of a lot of people in our profession.
Absolutely. I mean, this person was brave to come and talk to a room of 200 GP appraisers.
Sure.
And
it's not easy.
And perhaps not expect some sort of resistance, should we say, and challenges. Yeah.
And that will only make them think differently about their approach and the way that they handle things, and that can only improve things, I see.
Yeah. Well, it seemed on the face of it, there was a public veneer of the GMC backing down in light of the High Court decision and the MPTS's processes and so on. But as I say, this person came and spoke, and I think in the offices of the GMC there may be a different feeling.
And so sometimes you do have to agitate the milk, so to speak, to get a bit a bit of butter or cheese or
yeah.
I don't know, I like cheese anyway.
Me too.
I love cheese. I just can't put it down. And what's your favorite cheese?
I guess I'm a little bit of a traditionalist. I do like a nice mature cheddar.
Yeah.
But exactly. I'm blessed to live pretty close to the heart of Stilton, in the East Midlands. So there's some great villages around here that are well known for producing the best Stilton. So that goes down a treat as well.
Wonderful. So maybe professional regulation. New cheese might be coming out.
Who's the next big cheese? Yeah.
But I mean, medical leadership is sort of something that's becoming a bit of a buzzword now, and because you've been involved in leadership training, and so I'm going to ask the cheesy questions. What
Sure.
makes a good leader, whether it's medical or non-medical or legal, because you're sort of involved in quite a lot of different specialties. Yeah,
and I think you're right. I think the attributes of a good leader, and I'm in no way portray myself as an expert or a good leader as well. An
expert you are, Adam. An expert you are.
You're too kind. But they're obviously trans profession. So whether it's medical, legal, architecture, whatever. Politics, good leaders tend to, in my opinion, have the same sorts of traits. I'm becoming more involved in coaching, and I'm starting my coaching journey into leadership coaching. Excuse me. But I learned a certain amount. I had a very steep learning curve with my first medical leadership role as an assistant medical director at NHS England a few years ago. And I looking back, I can tell you the things that I wasn't as a leader that I would now be. More visible, more accessible. Just having more time to speak to people who are working at sort of a lower level in the organisation. Being I've always like to think I've been kind, but it's actually kind of like having the time and not letting the stress of the job detract away from, even though I'm going to be half an hour late to finishing, that person still needs, by the look of it, someone to just sit down with them and have a bit of a chat with. I'm very much falling in love with this concept of compassionate leadership and kind leadership. And you're right, it is all very buzzwordy and topical at the moment, but it's just an awakening that had to happen. And in fact, I had a guy who was an ex-surgical trainee post MRCS who wasn't enjoying life, working life. He contacted me on LinkedIn, wanted to talk about medical legal careers. So I put aside some time for him yesterday, and we spent about an hour and a half on the phone, and we were talking a bit about coaching. And he said that it seemed that coaching in the surgical arena was quite big about 20 years ago, and it seems to have sort of fallen off somewhat. I didn't know this because I'm not really in that arena, but that's a real shame. It seems that now we need it more than ever. I'm actually going to start to be a coach for an organisation called the Joyful Doctor. I don't know if you've heard of the Joyful Doctor.
Yes, Joyful Doctor. We've got Dr. Caroline Walker in our next event on the 11th of June. Excellent.
So I've spent some time talking to Caroline recently, and she's taken me on as one of her coaches. The idea being with her organisation to bring joy to the working lives of doctors. Yeah. And probably the world eventually. I think she has great aspirations and ambitions, and if she can't do it, then no one can. But I think that's what we need. You need as a leader to obviously get things done and have all the kind of classic business attributes of a strategic overview of things, and where's the organisation going, and all of that, which you can find in an MBA textbook. But ultimately, can you bring joy to the working lives of the people in your team?
And something really interesting you said. I mean, I've taken up a leadership role recently, being chief medical officer for a private healthcare organisation, and I thought I was a good leader, but I'm not. Because you see yourself how not to be. How can I say this? How I'm being not a good leader by being the leader. I saw. Do you know what? There are so many things I'm not doing.
How did you see yourself in that way? It's hard, isn't it? You'd almost have to have an out-of-body experience.
I thought I was a good listener, but I wasn't.
Right.
I thought I was accessible, but I wasn't.
Yeah.
I thought I was being myself and being human with my other colleagues, and I wasn't. Right. And I only realised that when the problems arose.
Yeah.
And that way I saw myself not being a good leader. I mean, I had all these buzzwords in my head. But when I took that role, that true leadership role, you see how you're not.
But listen, you can't be amazing in every category that you consider is necessary for leadership, and I had some coaching myself last year by an amazing healthcare leadership coach called Dr. Fiona Day.
I've had her on the podcast as well.
Super. Getting the right people. I don't know what I'm doing on here, but anyway. So, and she taught me about, my core beliefs and my core values, and everyone's core values are going to be different, but if you hold true to those, and follow those through with your leadership, like for me, I came to realize that gratitude is really important to me, and I mean personal gratitude, not for people to be grateful for me, and you won't be surprised to hear that justice and fairness and equity are really important to me. With my legal background, I guess I almost sort of shoehorned myself into following that qualification. And so if I kind of concentrate on my core values, and there are others, then and do those well, then I think I'll be a good leader. But you can't do absolutely everything, and you need to be forgiving of yourself.
Yeah.
And so you need to forgive yourself that you feel, you have a perception that you failed.
Yeah, and it is a learning process, but particularly in things that you haven't approached. And for me, it's a new experience, and the reason why I went into it is because I want to be in this new challenging experience, because I feel it's the next evolution in my self-development. Yeah. And maybe that's something that hopefully other professionals can look at, is sort of doing new challenges. It doesn't have to be work related, but it's sort of stepping into these new challenges to see what you're not, and just as much as what you are, if you know what I mean.
Yeah, and I agree, and that, I do try to do that myself. So if I think there's a certain type of patient, a certain type of condition or something that I feel a bit apprehensive about treating, my initial reaction will be to sort of step away from that. And then it's like, do you know what? I'm only going to become more de-skilled by doing that. I need to actually embrace it and chase up as many of those opportunities to see that sort of patient as possible. And then I'm going to be good. Then I'm going to get over my demons. And I recently said this to an appraisee of mine, who was had a complaint from a particular out of a particular type of patient, and it was a palliative patient, and he was just avoiding going and doing home visits for palliative care. And I said, no, what you need to seek out these opportunities, and then you'll get over it. Don't avoid it.
Yeah, I mean, it's this element of fear, isn't it? Sort of fear consuming you, and you allow the fear to sort of take over rather than recognizing it, processing it, and then see how you can either minimize the fear or sort of transform the fear rather than transfer the fear. Yeah.
It's really hard to do. I mean,
it's hard. I mean, none of these concepts are easy. Yeah, but we've got to step up, I guess.
Yeah.
I mean, these podcasts are not easy. People think, it's whatever and this and that. No, it is a challenge, and it's very difficult, but yet it's interesting.
Yeah. Well, it's my first one.
Oh, really? Well, there you go. I tend to do stuff like the first one, and then once the first one's done, they say, do you know what? I'm going for the second.
Yeah.
So
well, that's it. But I was sort of nervous. I'm like, but do you know what? It's Haidar's a nice guy.
Yay, that's nice.
He'll go easy on me. And then he's out of the traps. He starts with questions on professionalism.
Yeah, and GMC, and like, fuck, what the fuck is going on now? This is bloody hell. And this for you thinking he's a nice guy. What a bastard. What can I do? I mean, I guess it's this sort of unpredictability. It's probably the Iraqi blood, isn't it? We're very unpredictable.
Mate, I couldn't possibly comment.
That's your barrister sort of coming out there.
Yeah.
So, I mean, let's sort of, because we're coming towards the end, just sort of on a practical note, if a doctor gets a complaint or a professional gets a complaint, are there some sort of general things or specific things that are really important to sort of do so that they can get themselves out of this sort of fear mindset? And
yeah, I mean, I guess it's one of those things. again, with your youth and your inexperience as well. I was talking to a colleague a couple of nights ago who is a GP partner. She has a locum doctor who's actually managed to collect, I think, her third complaint in the last 4 months, and she's a newly qualified GP. And I kind of casting my mind back to those days when I was at that level, that would have devastated me, absolutely devastated. Even the first complaint would have absolutely devastated me. And I'd have been full of self-doubt and full of fear. What's going to happen to me? You get paranoid. You think everyone knows about it. But it's just kind of take a breath, take stock. Get some wise counsel. Have a look at it. Speak to one of your colleagues in your practice or your team. If you're in hospital, speak to a consultant that you like and trust and value their opinion. That may not be your immediate consultant. Get some sort of perspective. They'll very, very quickly, an experienced person will very quickly put it into perspective for you. Oh, you've got your first complaint. You popped your cherry. Don't worry about it. We all have to start with the first one. And they'll really kind of take the intensity down several notches, demystify it for you. Say, look, this happened. This is the crux of it. This is what you need to do. I'd always advocate people at least touching base with their defence organisation, simply because if it does escalate, and sometimes these things do, then they need to be in ground floor level, and also they be a bit reticent about helping you if you've already sought some help elsewhere at the start, because like anyone, they can't vouch for the quality of someone else's work. So they want to be in at the outset, and they're very good. I used to work as a medical legal advisor for the MDU, and really, really good at reassuring doctors. It's doctors are patients to a medical legal advisor in a way, and they come with all the same insecurities and baggage that patients do, and some of them are worse, much worse, and some of them you can kind of see how they might have got themselves into trouble because they're sort of lacking insight. But yeah, don't panic, seek wise counsel, and it's never an emergency. If you get, I had a chap I was helping very recently who was given a sort of turnaround time of 5 working days to respond to NHS England. I said, that's not right. I said, contact your defence organisation. They'll write a letter saying that's not appropriate. And he's done that, and he's got an extra month. But when you see something on paper with a letterhead from an official organisation, you just panic and you think, oh my God, I've got to do exactly what they say. If they want it tomorrow, I've got to do it for them for tomorrow. No, you don't. You just phone them and get it deferred. They're actually the case handlers, even at the GMC, and I've had a GMC complaint against me. They're actually, in my experience of one, very understanding. But always good to speak to an experienced colleague who you trust.
Wonderful. So if people want to get hold of you, what's the best way, Adam? Email is good. Adam.harrison3@nhs.net. I'm on Twitter as Dr._Adam. I'm on LinkedIn as myself, Dr. Adam Harrison. Facebook is more kind of social stuff, not worky. And your company? The company is the coaching company?
Fledgling company is called DocLaw, capital D, capital L. I kind of specialise in helping people whose MDOs can't assist them. So it's usually more like probity things arising out of your personal conduct rather than clinical matters. But yeah, happy to help people through that. As I say, it is just kind of getting up and running very slowly. Too many other things going on in my life.
Yeah, I know the feeling. Thank you so much, Adam. It's been great.
Not at all, Haidar. My pleasure. Thank you.
Thanks for listening to this installment of the Surgical Spirit podcast. For all the latest in the world of surgical spirit, don't forget to follow on Twitter at The Third Eye Doc and catch me on Facebook at the page The Third Eye Doctor. You can visit the website at www.thethirdeyedoctor.co.uk for more information on the work that I do. And please send us feedback and questions and suggestions for the podcast. It's always a pleasure to hear from you. I've been Dr. Haidar Al-Hakim, and I'll see you next time.